Guys, welcome to SK Classes NZ again. So today in our video we are going to discuss about one of the common condition, that is stroke. I think you people are very quite familiar about this medical term. That today we are going to focus on this disease. That what is stroke, what are the main signs, symptoms, how we can know and how we can judge that this person is going under the stroke, and what type of treatment that should be given to a patient or a person, and what type of precautions that we can take to prevent the person from the stroke. So let's discuss about the stroke. So now the question arises that what is stroke? Okay, so what is stroke actually? That what happen sometimes in our brain, that some area that gonna depletion of oxygen. Okay, when this is a type of ischemic stroke, that sometimes one part of your brain that is having a less oxygen, so that area gonna blocked, or you can say in this stroke the oxygen level to one part of the brain that will be reduced. So in that situation what will happen? The stroke is there. Okay, means if your brain is not getting proper oxygen, so what will be the result? That area or you can say the cells, the brain cells which are present in that area, that will die within minutes. Okay, and the memory which is related to that area, that is also depleted. So this is actually what is known as stroke. Some strokes are of various types. Some are hemorrhagic strokes, and some are transit strokes. So we will discuss one by one. Actually, the stroke is a medical emergency and it's crucial to get medical treatment right away. Okay, and getting emergency medical help quickly, that will reduce brain damage and other stroke complications. Means if you can call or you can bring the person who is having a stroke to the doctor, so immediately the treatment should be provided to the patient or a person, and there is a less damage of brain cells will be there. Now how we can know that this patient is going under the stroke? The person who is having this problem, he or she always having a problem or trouble in speaking, and that person will not understand what the other people are saying. Okay, so from that we can judge that this patient is having a stroke or going under the stroke. Even though the patient who is experiencing the stroke, that will always having a numbness, weakness or paralysis in the face, arm or leg. Means that person always told you that my this leg is not working, my this arm is not working, I'm having no sensation in this arm. Okay, so whatever he or she is speaking or are telling you, or that person always having a trouble in speaking, you will not understand that what the person is saying. Apart from this, some peoples are having a problems in both eyes. Means that person always told you that I'm not watching, or I'm unable to see these things properly, and that person always complained regarding I'm having a severe headache. Okay, so these types of signs symptoms are there. Even though suppose if patient is having a problem in the leg, okay, so he or she will not walk properly. Okay, so means there is a numbness is there. Okay, the patient is unable to see the things properly, patient is always having a speaking trouble, or whatever understanding problems that what other people are saying. So if these sign symptoms are there, so you have to you can assume that this patient can be a case of stroke. Okay, balance coordination that will be disturbed, means people is totally unable to walk, or okay, so these are the main sign symptoms which are related to the stroke. And if these types of sign symptoms are there, so what you have to do at your own level, you have to follow the one quick target, or you can say one quick test, that is FAST. Now what do you mean by FAST? F stands for face, A stands for arms, S stands for speech, and T stands for time. Now what do you mean by fast? F for face. So means if you have seen that this patient is having a little bit sign symptoms regarding or related to the stroke, so what you have to do, you have to say, ask the person to smile. Okay, then if when the person is smiling, what you have to notice, you have to notice is, does one side of the face droop, means the patient's face is going to one side or not. Second is arms, means you have to ask the person to raise both arms. Okay, then you have to notice, is the patient or the person is able to drift the arm downward. Okay, if one arm is unable to rise, means if patient is not taking or raising his or her arms upward, then and saying that my this arm is not going upward, so it means that can be the sign of stroke. Then next thing is your speech. You have to ask the person to repeat a simple phrase, means you can tell any word to the person that speak this. Okay, if he or she is unable to speak that phrase, it means that patient is going under the stroke. Then comes your time. Okay, means if you have see all these signs that you have noticed or you have judged and you have tested, and apart from there's a lot of other sign symptoms are also there, then you have to call the medical emergency. Then comes your life risk factors or medicine factors, that what are the main factors that can lead to stroke. So first of all, one is your overweight, means if your weight is more, so a lot of chances are there that you can get stroke. Then physical inactivity, means if you are having a sedentary lifestyle, no activity is there. Then if you are a heavy smoker, okay, if you are a heavy alcohol drinker, then even though if the patient is taking illegal drugs like cocaine, okay, so that patient can have a lot of chances to get stroke. Apart from this, if the patient is having a high blood pressure, or if the patient is a cardio patient, means having a cardiovascular complications, and if the patient is diabetic, and if the patient is having a high cholesterol level, so all these factors that can lead to stroke. So this is all about the stroke. This is all about the stroke. In our next video, we will discuss about the types of stroke and what type of treatment line to be provided to the patient or a person if he or she is suffering from the stroke. So till then, thank you for watching SKK Classes NZ, and don't forget to subscribe my channel. Thank you.